Okay, Michalis, so a question about DDH. This is a question that commonly comes up in courses on which we teach, and it's a question for common clinical practice. So scenario is a child with a neonate with an unstable hip. You've treated in a Pavlik harness. You've done an ultrasound scan at 2 weeks, expecting to find that the hip is reduced, and it's not. The hip is still dislocated. So what would be your advice to how to proceed under that circumstance, because it's tricky?
So in my experience, but also it's been described in the literature, there's two things that you can do. The one thing is try to use a more stable harness, such as a von Rosen splint. You're trying basically to force that, if that's the socket and that's the femoral head, try to force that femoral head to go in and maintain that reduction. Another trick that you can do is you can move the anterior straps of the Pavlik harness posteriorly. Again, it does the same movement, and you can check a week later to see if you have achieved femoral head reduction. If not, then you have to stop. And maybe after consultation with the parents, you decide to stop anyway, because that's a failed Pavlik harness treatment, which can be quite harmful if you insist of that, because if you have the femoral head outside of the socket, that can mold the wrong place, like the edge of the acetabulum, and cause more of a dysplasia. Once you have a failed Pavlik harness treatment, despite the two tips that I've just told you, I think you need to plan for a trial closed reduction in the operating theatre under general anesthetic.